Celiac disease is actually an allergy to gluten, which is a protein. And sometimes people get mixed up with celiac because they confuse it more with gluten sensitivity, but it's truly a gluten allergy. And it's one that at one point we did not think it was as common as it is, but it is more common, and at least in like 2 to 5% of the population. And it can be very tricky to pick up. It mimics other diseases, especially mimics irritable bowel, IBS, spastic colon. So you can have a hodgepodge of symptoms, and that's why it is sometimes delayed as far as making the diagnosis. You can have bloating, you can have weight loss. Someone can tell you, the doctor's office calls and says that you're anemic. You can have diarrhea, constipation. So you have to really be thinking about it. It can be important to rule out because it helps you to define what therapy is going to help your problem. Some people go along trying some of these over-the-counter medicines for bloating and gas, and they may be helpful, but if you have celiac disease, there's probably more definitive information that you need to do to help maybe avoid gluten. Usually we'll get a dietitian involved, nutritionist to kind of help with you, and it requires some testing, usually blood work, and sometimes we do upper endoscopy and take sample biopsies. So the tip would be just to tell your primary care physician, your gastroenterologist if you have one, or any provider that you see that you're persistently having these problems and if they affect your quality of life.